between the normal flu and the coronavirus?
That's a very good question. It's very difficult to separate between these the infections which will cause the cold, flu, and now the coronavirus. They belong to a different group of infections, so the symptoms are different. The coronavirus is a new infection, so there's no immunity for this infection yet. So the symptoms are more severe. There are the differences between the common cold, the flu, which is more severe form of cold, and the coronavirus now. So the incubation period, which means the time from you catch the infection to symptoms coming up, is around 3 days in common cold. It's up to 4 to 5 days in flu, and up to 2 weeks, 2 to 14 days in coronavirus. The symptoms in the common cold will start very gradually. Again, in coronavirus, they start very gradually over 2 to 14 days. But in flu, which is more severe form of cold, the symptoms can start very abruptly or suddenly. And the symptoms usually last in common cold between 7 to 12 days. In flu, they last up to a week. In coronavirus, in mild cases, it will last for 2 weeks. And if they are severe, they can last up to 3 to 6 weeks. There are also differences between symptoms between common cold, the flu, and the coronavirus. Fever is not present in common cold. In flu, you can have fever, and it's very, very common with coronavirus. Runny nose is common in cold. You can see the runny nose sometimes in flu, but most of the times not. And coronavirus also, you won't see any runny nose. Sore throat is very common in cold. You may see it in flu, and it's not present in coronavirus, or very less commonly present. Cough, this is very important. It's again common in cold, but not present in flu, but it's very, very common in coronavirus, and it can last for a week also. Body aches are rare in common cold. Severe body pains are present in flu, but again the body pains are not present or very uncommonly present in coronavirus, or less commonly present. The last one is the difficulty in breathing. We also call it as dyspnea, or shortness of breath. It's not present in both common cold and flu, but very commonly present in coronavirus. So in the coronavirus, the 3 symptoms you have to remember is very high grade fever, a cough which is lasting for almost a week, and shortness of breath or difficulty in breathing, or it's also called dyspnea. If you have these 3 things, plus you have a history of visiting a country which has this epidemic recently, or coming in contact with a person or a group of people who had the infection, then the suspicion of coronavirus is very high in you. Thank you.
Has anyone recovered from this virus?
Yes, the initial information we got from China, 80% of people who got infected with this virus has recovered. 20% had moderate to severe infection, out of which the moderate infection people also recovered, but they needed intensive care. And a very small group of patients, around 3% of the total infected people, died either because they are old, above 70s, or they have the concomitant diseases like diabetes, hypertension, or they had long history of smoking. So 80% of the people who got coronavirus infection initially completely recovered.